Hello, thank you for taking the time to review this video, which has been made to facilitate education within the practice environment using cue cards. The primary audience is clinical educators or students who are on placement. For clinical educators, the cue cards might help a student who is perceived to be struggling to identify the level they are working at, which can then be used to design learning activities. Equally, it can be used by a student who is on placement who might be struggling to find out how to demonstrate their abilities. It will give them the idea of how they can assess their own level and then work to the next level to show how well they are doing. This specific example is regarding the subjective assessment within physiotherapy. The first cue card is Identify. This card can be used to work out whether or not a student can identify assessment themes from a word bank. In practice, you could give your student a simple sheet of paper with lots of different terms on it, including subjective assessment themes. There's lots of red herrings on this sheet, which they should try and avoid, but also they could extend their learning by trying to think about what those other terms also mean. For example, the Oxford knee score could be identified as subjective information, objective information, and in itself an outcome measure. If the student identifies the uncertainty of whether or not this is subjective information, the following discussion could identify their ability to have an analytical and sophisticated conversation about this. The next cue card is List, and this tries to identify whether or not the student can list assessment themes independently without prompting. So beforehand, by giving them the word bank, you are prompting them and they simply have to look at the sheet and see which ones count. However, in this instance, they would be asked, please name me some subjective assessment themes, and they would have to do that, recalling the information independently. The next cue card is Describe, and this seeks to find whether or not the student can identify what the assessment theme actually investigates. For example, medication history, they might be able to blurt that out but not actually know what it means, so they should be able to say, I'd ask questions regarding the patient's use of medications to do with any health problem. We build under the Describe cue card with the Explain cue card. So whereas describing, we are simply seeking what the assessment theme is, explaining is finding the function and utility of the assessment theme. So for example, with medication history, they could ask this in order to give insight into health conditions that the patient didn't believe would be relevant to them during the assessment. So your patient may not think it's relevant to mention that they have anxiety and depression, but seeing that they are taking sertraline might lead to a conversation into this. Another example could be that it gives more insight into the intensity or the time frame of their complaint. So for example, if a patient had been on pain medication for 3 or 4 months, this would give an idea that we are dealing with quite a long time frame, and that it could be intense because it's been using quite a serious medication for that period of time. We can now see the addition of this little square, which identifies that some students will do this poorly and some students will do it well. So stage 1 is just identifying whether or not they can carry out the task on the cue card. Stage 2 would be identifying the level of sophistication they can have with that conversation. Is it prompted? Is it free-flowing? Are they mentioning few simple ideas, or are they mentioning multiple quite complicated ideas? If we develop the cue card set, there will be separate cue cards for this entity. The next cue card is Apply. So now we are trying to see whether or not they can demonstrate application of assessment themes in practical situations. So they may be able to demonstrate it on a model, and to assess this, you might set up a role play with a different member of staff who hasn't been interacting with the student much. Give that member of staff a case study and assess if the student can ask the questions that are used within the subjective themes. Once we've identified that they can do that, we might then try and see if they can do that with a patient. However, to really accurately assess the assessment themes, what we should do is specify the detail of the task. So although they might be going and spending a time of like an hour with a patient, you can go, the success in this task will be that you've managed to get your subjective themes out in front of me, and I'll be specifically looking at how you apply your conversational skills to explore these subjective themes. The next cue card is analyse. So now we're checking whether or not the student can link all the assessment themes together, analyse them, and formulate problem lists. They may be able to demonstrate this using case studies. So you could give them a case study overnight and ask them to collect subjective information, which they can then analyse and come back to you the next day with a problem list. This obviously would give them a little bit more time, but it is accurately identifying whether or not they can identify subjective information. You could then use this to have a discussion to enhance learning as a separate learning activity. However, a student might be very capable of analysing a case study overnight, but struggle with the patient. And this indeed might be the reason why you are thinking that your student struggles with subjective information within the clinical environment. This would allow specific identification of the problem. For example, they might have difficulty collecting the information in real time. They might have difficulty linking those ideas together after they've collected it in real time. And they might just have difficulty performing the analysis quickly or in front of you. So if we've followed all the other cue cards, we can go, actually, you do understand subjective information and how to collect it. It's just that actually the problem is with the performing and doing this in the real world environment. Subsequently, if you identify one of these examples, you could use it to design a specific learning activity. So for example, if they are struggling to perform it in front of you, you could set them the task of doing a presentation. So you give them the time to go away, and then they have to deliver the information back to you within 5 minutes in a handover situation. You could then tell them that the next task along this continuum would be, rather than them having overnight to develop this presentation, you're going to give them 10 minutes to develop that presentation. And then finally you can tell them, you're going to have 90 seconds after collecting all that information, and I'd like to see all the subjective analysis done as quickly as possible. As we move up the learning verbs, it does become more difficult to assess them, but it does allow you to identify where the student has a problem and identify a level where that can translate onto the CPAF. They may not be able to fully apply the subjective assessment skill set, so get 70 to 100%, but they may have a foundational underpinning for future learning without failing, so 40 to 70%. So with those students who are failing to collect the information in front of a patient under the pressure of you, they may actually understand the basis for which they could develop this after the placement. If you accurately identify that for them, it's really good for their continued learning. So thank you for taking the time to have a closer look at learning verbs. Whilst this was how to apply the learning verbs to the subjective assessment, this can be done with many other themes of physiotherapy as listed. Please note that this is the first iteration of these cards, and there are lots of holes and lots of needs for improvements, which hopefully will come soon and we'll be able to update you as needed.